Good afternoon and welcome to the ISAG seminar. My name is Anthony Stones and we're going to be talking today
Recording in
mostly
progress.
about the impact of new variants of COVID-19 on cases of COVID in Ireland and Northern Ireland. We're going to start, as we usually do, with the review of the data, which will take surprisingly short time. In the Republic, because of the ransomware attack on HSE, the data systems that we use to monitor COVID are not working. So the only information that's available is the daily case numbers. Now, over the last few days, those case numbers have been a little lower than heretofore, but they're still around 350, 360, 370. And case numbers have been between 350 and about 450 for over a month. So whatever is happening in the Republic of Ireland, we are failing to bring case numbers under control. And as you know, various parts of society are opening up over the next couple of weeks. The government has given an explicit commitment that it's willing to do things like bring back localized lockdowns. It's willing to change tack as the data develop. But the data itself is quite limited. In Northern Ireland, the situation is much more positive, and for technical reasons, which is, to be precise, entirely and exclusively my fault, the image from Northern Ireland, which my colleagues carefully prepared, is on a computer which has temporarily stopped working. But in a nutshell, the case numbers in Northern Ireland are declining fairly steadily across most age groups. They've declined fastest in the oldest age groups where vaccination has been most complete, which is very positive. And they're not showing signs of the kind of rises that we're seeing in parts of the United Kingdom, and particularly in parts of Northern England, which is very positive and will hopefully continue. But obviously we don't know how long it will continue for, and we don't know what the implications of that are for ourselves. But to explore those implications and to talk more about variants of COVID-19 and how they might affect us, I'm bringing you over to our speaker, Professor Chris Pagel, who has very kindly agreed to talk about her work on the new variants in the United Kingdom.
Hi, everybody. Could we have the first slide, please? Yeah, great. Thank you. So I'm just going to go through the story of B.1.617.2, which is now called the Delta variant and was first sequenced in India. And I'm going to tell you about its story in England. And I think it's very much a cautionary tale. And I am concentrating on England because that's where it's dominant now. I will say that it's still at very low levels in Northern Ireland and in Wales, which I think does explain why cases in both of those two home nations are still going down. So next slide, please. So I'm going to start in mid-April. And this is when India was really in the middle of its terrible surge. I mean, the situation there is still pretty bad. At this point, Pakistan and Bangladesh were on the UK travel red list, which meant that people coming in had to have managed isolation. India was not. Boris Johnson was still planning a trade visit there later that month. I was highlighting it in the middle of April and saying, why are we not more worried about what's happening in India? The Indian government had said at the end of March that there was a new variant, B.1.617, that looked to be partly behind the surge. And it looked as if even at this stage that it was potentially outcompeting B.1.1.7, which is now called the Alpha variant, and was the one from Kent. So next, please. So then around this kind of time, Public Health England said, okay, yes, there is a new variant. We're putting it under investigation. But they highlighted and said there's currently no evidence to suggest that the new variant is more serious than previous mutations, nor is there evidence that it indicates that vaccines are less likely to work against it. And that's why they said they weren't making it a variant of concern. Now, various people like me were saying, look, we know that things are pretty bad in India. We know that there's a lot of anecdotal evidence about some breakthrough infections in vaccinated people. We know that it has mutations that are associated with vaccine escape and increased transmissibility in other variants. So I felt that there was enough circumstantial evidence to be more worried about it, but at the time, it was just made under investigation. So the next slide. Overall, it was still hardly anywhere. So yellow is no cases of this variant, white is no data. So just in a very few locations in the middle of April. So at this point, it was still controllable, maybe a few hundred cases. Next slide. But what you could see, and this is a tweet I wrote on the 18th of April, is just looking at it in terms of the proportion of cases, it was shooting up from the end of March onwards. So when Delta variant arrived in the UK, 27th of March, it was doubling every week. And I said, it's gone from 0.2% to 1% of cases in 2 weeks. You're not going to see any impact on overall case numbers, but we know that it's doubling. We know that it has started. This is the very, very first stage of exponential growth. And it was doing it under lockdown and under very severe restrictions and in a situation where we had a lot of vaccinated people. So I'm thinking there's something about this variant that looks quite worrying. Next slide. By the beginning of May, it had spread to many more regions in England, concentrated in London and the Midlands, and then also in the Northwest. Again, at this point, people were trying to explain it away. There were lots of explanations. It's just traveller cases. In this case, for the Wellcome Sanger Institute, they removed cases from travellers. Or it's just unlucky that we've happened to have some clusters. Or it's just, chance, or it's some kind of feature of the communities where it's spreading in. India is not relevant because India is not like the UK. All of those explanations were trotted out. And I'm like, well, maybe, but what if we're wrong? So next slide, please. So by the 1st of May, it was over 10% of English cases. So you could clearly see that Delta was eating in on Alpha's dominance, which had been pretty much unchallenged for several months now. And compared to the other variants, which are those tiny little lines at the bottom, it was clearly doing a lot better. So the other variants that we've had in the UK just haven't managed ever to get more than a handful of cases a week. Next slide. By mid-May, it was 15% of cases. By this stage, Public Health England had upgraded it to a variant of concern on the 7th of May. That meant that now when it was discovered, it triggered things like surge testing, extra contact tracing, and so on. And it was still doubling every week. So it's not just that proportionally it was getting bigger and bigger. The actual number of cases was doubling every week. And we were now at, almost 700 cases and far more than any other variant in the UK. Next. There were now new estimates coming out of India. This is from Tom Venselis, who helped the UK government pin down how much more transmissible Alpha variant was in December. And he showed that by looking at Indian data, it looked as if it was about 60% more transmissible than Alpha. And again, people kind of try to dismiss this and say, well, the data is really sparse. India doesn't sequence very much. And that's certainly true. But every single time he's repeated this on more data, and from any country, he gets very similar estimates. Next. By the 15th of May, the map now looks like this. So again, it's increasing its spread. The hotspots are getting hotter. Next slide. And now we know that by the 15th of May, it was about 50% of all sequence cases. I mean, the speed at which this variant increased is really quite astonishing. And up to the 15th of May, we had no indoor mixing in the UK. You're allowed to meet up to 6 people outdoors. Shops were open, but indoor pubs, indoor hospitality, all of that stuff was shut. So we were still in quite restricted conditions. Next slide. And this is one of the key problems that countries have, right? We know now at the 15th of May that it was 50% of cases, but sequencing takes a long time and it's normally 2 weeks out of date. So on the 15th of May, what we knew about was the situation on the 1st of May where it was 10% of cases. Now, for people like me who've been kind of obsessively tracking the rise of this variant, I was still really worried. But people could still say, well, it's still 10%, we don't know, maybe it'll slow down, and so on. So next slide. However, on the 13th of May, the government advisory group, SAGE, they had an urgent meeting, and the minutes were released very quickly, and they said, you know what, we now think there's enough evidence to say that Delta B.1.617.2 is more transmissible than Alpha, so B.1.1.7, and it could be as much as 50% more transmissible. This is really high. And so they said, considering this, there's a realistic possibility it could lead to a very large increase in transmission and could put unsustainable pressure on the NHS. This is what they said on the 13th of May. So next slide. And this was based on modelling from the Warwick and from Warwick University and London School of Hygiene and Tropical Medicine. And what they said that what we were planning on the 17th of May was a move to step 3 of what's called the roadmap out of lockdown, which involved opening up spaces. And basically they said, if you do that and you have a variant that's only 40% more transmissible than Alpha, even if it's no more severe, even if vaccines work just as well, you can get the same kind of peak in hospitalizations as you got in January. So that's what these minutes said in May. They said, if you then proceed to full opening, which we're planning in June, then you could have double the wave that we had in January. Next slide. However, easing of restrictions went ahead on the 17th of May. So this now meant that in England, 6 people from different households can meet up inside and they can stay overnight. Hotels are open, B&Bs are open, pubs, cafes are open, museums are open, galleries, theatres, concerts, gyms, all of it is now open. We're pretty much under the least restrictions we've ever been in since the pandemic. And one of the big things they did in schools was they said secondary school children no longer have to wear masks. Next slide. The very next day, Matt Hancock, the health secretary, confirmed there were now over 2,000 cases of this variant in the UK, and it had spread to 86 local authorities. Next. And this is now the very latest data we have. It goes up to the end of May, end of last week. Again, it excludes travellers. And it's now almost 80% of all cases in England are the Delta variant. It looks like it might be slowing down, but actually the last week is still quite incomplete data, so we can't read too much into that, but it is still going up. Next. And this is it just showing by every region. It's going up steeply in every single region. We have lost control of this variant. We cannot put it back in its box. Whatever it comes with, England now has to live with. Next. And this is just showing kind of what's happened. So the blue line there is Alpha, so B.1.1.7. And you can see that in early March, children went back to school. That was a big change. Cases did go up until the Easter holiday started. And then we had a really rapid decrease over April in the main variant. And that led to big drops in overall cases. And then as schools went back and we opened up a bit more on the 12th of April in England, cases were still going down of the Alpha variant. But you can see that from April onwards, this new variant Delta was gaining ground and doubling every week, and it still is, right up until the latest data here, which is 22nd of May. Next. And then we have more evidence now, now that actually it's too late to do anything about it. We now know that actually it does have some vaccine escape. This came out of Public Health England data at the end of May. So after one dose of vaccine is now only prevents is 33% protective against symptomatic infection, so getting symptoms of COVID. It still works pretty well once you've had 2 doses, 81%, but it is lower than against the other variant. And England is a country that has bet the house on a kind of extended interval between vaccinations. So actually we have a lot of people on 1 dose or no doses of vaccine still. This was reported as good news in a way that I still find very surprising, particularly as Public Health England itself increased its risk assessment of vaccine escape for this Delta variant from moderate to high, so from orange to red. Next slide. They also now are pretty sure that it is a lot more transmissible. Looking at contacts of cases, they've shown that compared to the Alpha variant, it's 67% more likely to infect a contact, which is even higher than the advantage that Alpha variant had over the previous type of COVID from last year. Next slide. And again, the Public Health England says it's very high risk. It is more transmissible, both than the wild type, which is the first type of COVID, and also B.1.1.7, which is the new Alpha variant. Next. And where is it spreading? It's spreading mostly in younger people who are unvaccinated. That's not surprising. It's particularly spreading in school-aged children. So overall in England, cases are highest in 10 to 19-year-olds. These are three of the biggest hotspots with the Delta variant, places that have it over 80-90% for the last few weeks. You can see that cases in basically 10 to 14-year-olds, the orange bars, and the red bars, 15 to 19-year-olds, are really sky high and much higher than their 20 to 24-year-old counterparts who also haven't been vaccinated but are not in school. And this is in the context of them having removed the mask mandate on the 17th of May. Next. This is just showing you from the Office of National Statistics, where they test a random subsample of the population every week. And now also a couple of weeks out of date always, but it's now showing also increases in school-aged children. Next. And this just kind of shows you what I think the problem is. So if you have a situation where you have a dominant variant declining, which is the blue line, and another variant taking over, which is the red line, then the overall number of cases, which is the black line, either keeps going down and stays flat for a really, really long time. It's not until the new variant really overtakes the old variant that you start seeing an uptake in cases. But by that stage, it's too late. And I think if you only ever look at overall cases, you completely miss the fact that you've got two epidemics, one of which is declining and one of which is actually on a new wave, an exponential increase. Next slide. So this was, the black line there was illustrative data. The orange line is actually what's happened to case numbers in England over the last month. Next slide. And you can see over the last week, cases have now gone up by 32%. And it's not just cases, hospitalizations have gone up by 23%. Now, there's absolutely no doubt that vaccination has massively weakened the link between cases and hospitalizations. For the same number of cases, in January, we are now seeing fewer hospitalizations. But if you can get enough people infected, and we have a brand new transmissible variant to do that, you can still create pressure on your hospitals. Next slide. And as of yesterday, now people are saying, oh, the UK is in the early stages of a third wave, or it may be underway. Scotland as well is having exactly the same problems with the Delta variant. Also, like their chief scientific advisor said yesterday, it's at the start of a third wave. Next slide. And this is just showing you again this idea that it is really two epidemics. The blue here is Alpha variant, the pink is Delta variant in different regions in England, and all of the regions it's growing. Where it's dominant, they've seen big increases. Where it's not yet dominant, the overall case numbers have stayed flat. So really what we're saying is that the wave didn't start yesterday. The wave started in April. It started as soon as Delta variant started doubling, which it did pretty much from the first week it was here. And we knew it was within a few weeks, and we just didn't do anything about it. Next slide. And this is the final slide. So I think the problem here is that the onus was always, we have to prove, we have to wait until we're sure that something's bad. But that definitive evidence of higher transmission or vaccine escape, which we now have, often comes too late. It's too late for us now. We basically have to live with whatever this variant brings us. So I think one of the key lessons is if something is growing quickly, but numbers are still small, that is the time to act. And I cannot quite believe that we still haven't learned that in the UK, to be honest. That's the time when you have to act, then when you can do something about it. Sorry, I can't. Can you make it big again? Because I can't. Right. So the best situation that we have now in the UK, or I should say in England and Scotland, where it's dominant, is that we will have, whatever happens, more cases of long COVID, more hospitalizations and more deaths than we would have had were we still under the Alpha variant. the worst case scenario is that we now have a devastating third wave. And we are still vulnerable to importing new variants because our border policy is pretty rubbish. We've opened up international travel again from the 17th of May as well. And it also means that we are now potentially exporting this new Delta variant to other countries who perhaps are more vulnerable than us. And we're also still vulnerable if we have loads of increasing cases of growing our own new variants that are even more vaccine resistant than this one. When it comes to Ireland, case rates are higher in Ireland than they are in England, about twice as high, and vaccination coverage is lower. So right now, the Delta variant is a very small proportion of cases in Ireland. I kind of think, Ireland had a go at being England in January with the rise of the Alpha variant when you had that really big surge at the beginning of January. So my advice to you is just do not do it again. Please just learn from what's been happening in England. And that's it. Thank you.
Thank you very much. That is sobering, I think, and it's really informative. So what steps do you think we can take now in Ireland? What should you be taking in the United Kingdom to bring this under control, given that it's here and it's likely to spread unless we do something else?
So I think the steps you would take in Ireland are slightly different to the steps you would take in England, just because it is dominant here now. But one of the key things is really, really good contact tracing, local, on the ground contact tracing, door-to-door testing, and proper wraparound support for isolation, which includes financial support, but also I think offers of accommodation is really important. We know that household contacts, are 67% more likely to get infected than they were under the old variant. That means that isolating in your own home, if there are lots of people with you, is actually a recipe for getting them infected as well. So I think we do have to now start thinking about, actually, should we be offering people accommodation outside the home, and how do we manage that? I think, to be honest, I don't think Ireland should be encouraging travel from the UK. I know that's very difficult because of the really strong links, and obviously you can't really do that with Northern Ireland, but Northern Ireland doesn't have hardly any of this variant, thankfully. So that's a good news. Other things, I think we know that it is spreading in unvaccinated populations. So it's, how do you make those places safe? And the biggest places where people who are unvaccinated are mixing right now is schools. So how can you make schools safer? So, part of that is keeping with bubbles, keeping with mask wearing, but also real concentrating on ventilation, which is easier in summer than it is in winter. And I think that's something that in England, we just haven't done at all. So we haven't really made any good efforts to make schools safer, for instance.
I think we are not in a dissimilar situation, but our secondary schools have closed. So in secondary schools, the only students back are those who are doing their final examinations. Primary schools obviously are still open till the end of this month. So that may be a benefit for us. There's a question that's been asked, which is, why are these variants more transmissible? It may be more of a virological question. It may be more of a question than a question you're addressing, but it's an understandable question.
So it is more of a virology question. It looks, just from the papers that I've read, it looks as if there's some of the mutations it has allow it to bind more easily to your cells and reproduce quicker. Now, that is as far as my virology knowledge will take me. But the other reason that it's potentially got a transmission advantage over Alpha is that it does have some vaccine escape. So it looks as if it can more easily infect people who've either had COVID before or have had one dose of the vaccine. And that obviously means it has a bigger pool of people in which to spread. Now, what we're seeing is that people who've had one dose, particularly if they've had 2 doses, they're not getting very sick, which is good news, but they can still transmit it. And in India, there have been documented evidence situations where you've had quite long transmission chains through vaccinated people who themselves didn't get sick but still passed it on to other people. So that's another way that it's getting a transmission advantage.
Would any of our biological colleagues like to weigh in on that? I mean, Tomás or Sam or Aoife, would you have thoughts as to what's the nature of the extra transmissibility? Where does it come from?
I'm happy to talk about that, not so much in a sort of structural biology perspective, but more of a evolutionary biology one, which that when through sort of viral diversity, a variant arises that's more transmissible. Obviously, by being more transmissible, it becomes more prevalent in the population that it's in. So by definition, it grows more because of that attribute. So I see it a little bit as a natural selection of more transmissible variants to take over. At a molecular level, presumably there are protein changes and sequence changes or glycosylation changes that mediate that increase in transmissibility. It could be due to viral growth, or it could be due to stickiness to receptors in the airways that make it biologically more transmissible, or even social factors. But I see it as a natural selection of a more transmissible variant.
And in some ways, that's more disturbing than a straight biological answer, because selection is very likely to continue. The situation, the epidemiological situation in Ireland at the moment is that we have been keeping cases constant and fairly high level for the last month. So there's been very little change in case numbers. They go up a little bit for a week or two. They go down a little bit for a week or two. Currently, they've been down for the last 3 or 4 days. But the any sign of strategy in place to bring in the kind of things that you're talking about. So things like activated local public health. There is some support for isolation. It's a bit limited and a bit, but we're not. This does not seem to me that people are taking these risks particularly seriously. So is there a way that you would think of to communicate to political classes the magnitude of the risk that we're running and various strategies we might reasonably use to bring that risk down? Have you any thoughts on that?
For me, the answer is I don't know, because I've been trying, and not just me, but several people have been trying for the last 8 weeks, 10 weeks to kind of highlight the risk of it. And also not just me, but the government's scientific advisory group, like their minutes from the 13th of May, just before we moved to the last stage of opening, could not have been clearer about the risk involved. It was there in black and white. You risk having a surge as bad as January. We don't know. The best action is early and hard, and it was all in there, and it was ignored. And all I can think of is that it just doesn't feel true to people. That we know that we're doing well in vaccination. Particularly in the UK. It's sunny. People are going out. People, and me included, are really enjoying the fact that we can see people again. And I think people just cannot quite conceive that things can get bad again. It just doesn't feel true within them. And I don't know how to change that. I mean, I look at I've been looking at watching it doubling and saying, to me, well, it's beyond obvious, like what's going to stop it doubling? And yet every time I say anything, either on Twitter or in the media, I get the question, but what about vaccination? And I'm like, well, either you believe the scientific models, which say that even with vaccination, you can still end up with a bad surge. And you can see that in Chile's about to lock down for the second time with higher vaccination rates than us, because they've opened up and people are getting it. There's a limit to what vaccination can do. And we're not protecting our vaccine program by allowing, firstly, new variants into the country, and secondly, by allowing them to then spread and potentially mutate. And this is not going to be the last variant. The natural selection pressures are only going to get higher over the next few months as more and more people get vaccinated. And we're not protecting our resource. And I just don't understand it. I really don't understand it.
Christina,
Tomás,
coming in on
any thoughts on that?
Yeah, I kind of wanted to ask a follow-up question on that particular subject, because we seem to have a lot of confused communication with respect to vaccination, because on the one hand, the vaccines have been enormously successful, particularly for protecting against risk of death, including from many variants, and also very successful at reducing transmission, though not eliminating transmission. And of course, the Indian variant, what we call the variant that arose in India, is still transmitting very significantly, particularly after people have had the first dose of the vaccine. So communicating this along with risk to the unvaccinated population is a major challenge at the moment. In Ireland, we have vaccinated most of the very vulnerable people in our country, but we're nowhere near as far in our vaccination progress as the United Kingdom. And yet we can see what's happening with the Indian variant. What I found particularly harrowing was comments that you made a couple of days ago, Christina, on what the risk profile was for the United Kingdom if we have a surge there now that mirrors the infection rate between October and January. So if you take October to January levels of infection, and those were to happen now, which is perfectly possible with the way things are going, instead of having 15 or 18,000 deaths with the current rate of vaccination of people who are protected, there would be about 2,000 to 3,000 deaths. But the challenge now being with the Indian variant significantly increasing transmissibility, that 2 to 3 times more people could be infected or more, which would obviously significantly affect the hospitalization profile and would elevate the number of deaths in this wave, where theoretically it could still reach a similar level of damage as the second wave. And if that is to be prevented, it means having another significant bout of restrictions. So I noticed you said living with the virus. We have in England right now, it's necessary to live with this variant. And in Ireland, maybe we can still prevent that from happening. But in the narrative, we hear living with the virus. And to a lot of people in the media and in politics, that means getting on with life as normal, when in fact, living with the virus often means living with lockdown. And it seems to us that in Ireland, that right now we've got 3 choices. I can prevent this variant from taking over, which is going to have to involve travel restrictions, or we have 1 or 2 scenarios of living with this virus. One is we're going to have heavy restrictions over the summer, or the other is we're going to risk a significant number of deaths in Ireland, which could be well over 1,000 or 2,000 in a worst case scenario, along with a lot of hospitalization and a lot of long COVID. And either scenario, either restrictions over the summer or what I just said, neither is desirable. And I just don't think that the political class is really aware of that risk. I mean, previously they were making risky decisions, but in previous waves. But today I'm not even clear they're aware that this is a risk. And I'm just wondering what your perception of this is in the United Kingdom right now, and how we can make this message a little bit clearer.
Yeah, I mean, I totally agree with you. And when I say we're living with it, I don't mean we have to live with it. What I mean is that it's too late for us to prevent this variant now taking over in the UK. And it's too late for us to kind of go back to where we were. You know, actually in the beginning of April, end of March, we were in a pretty good position. We had low cases and our vaccination program was going well. And there was no particular sign that that would change. Now that isn't the case anymore. I am in favour of maximum suppression, partly because I think people are too concentrated on death and they ignore long COVID. And I think what's happened in the UK right now, or in England at least, is, you know, the government is today saying 75% of the population are vaccinated. It's not. It's 75% of adults have had 1 dose. And this kind of continual desire to place the rosiest picture on everything, I think, harms public communication. And it makes people believe that a second wave isn't possible. And by the way, it throws children under the bus. It's as if it doesn't matter if children get COVID, which I find just quite an unbelievable position. I mean, yes, most children don't get that sick with it, but maybe 5% have symptoms for longer than 3 months. That's quite a significant burden. When you have loads of cases in schools, people have to get sent home. It disrupts their education. We don't know what the long-term impact of having COVID is. I just find it a big risk to say, well, it's fine if it spreads in schools, whatever. I think, a couple of days ago, what I was trying to say is that, yes, people seem to think that if we have a third wave, it's because the vaccines don't work. And I think we have to explain to people that you can have a third wave with the vaccines working just fine if you have enough people infected, because a small percentage of a really big number is still a big number. And I think that's the key thing, is that, yes, if we had the same level of infection as we did last winter, we're going to have far fewer deaths. Still thousands of deaths, but far fewer than we had in January. But if we have 3-4 times the number of infections, which is quite possible with a more transmissible variant and a lot more opening, we weren't really open in December. And that's what people forget, is that the last wave was under a situation where we had a lot of restrictions, and now we're taking those restrictions away with a more transmissible variant that has some vaccine escape, and we're going, it's fine. I'm like, so it's not like, I honestly am quite baffled by the kind of the complacency in the British government on this. And I don't know whether it's that they don't understand the risk, or they don't want to understand the risk, or what I suspect is that they know the risk, but they know that they will only do anything when it's obvious to everyone that things are bad. So they don't want to act when things look good because it's unpopular. And so they'd rather wait until it gets bad and everyone agrees that, oh yes, no, now we have to act, and then hope that no one really notices that actually if they'd acted 3 weeks earlier, they could have saved thousands of lives, which is what happened in the last 3 lockdowns. So I'm not hopeful. I mean, I wish I had better answers, but unfortunately I don't.
That sounds, I think. We have a second question about vaccination, which I think is very relevant. It affects a number of people. Will 2 doses of vaccine be required to offer full protection, even to those who've recovered from COVID? Does anyone have any thoughts or knowledge about that? Sam, what would your thoughts be on that? You would.
I think I don't know.
Watch this space.
So I've seen papers that have shown that for people who've had COVID, the first dose of vaccine effectively is like having the second dose. So people who've had COVID have a much greater response to 1 dose than people who haven't had COVID, but they should still get the full course, and then they'll be like super immune. So but yes, but like the data that I've seen in papers, and there's been quite a few papers now that have shown that people who've had COVID have a really, really good response, a better response to 1 dose than people who haven't had COVID.
Yeah, I think the message about vaccination is relatively clear, that worst case vaccination greatly reduces your risk of something bad happening. Even if you're unfortunate enough to get COVID, you are much less likely to be seriously ill. You are substantially less likely to die if you get vaccinated. And I think giving that message out very clearly is going to be very important. The other issues about messaging that are coming up are, what should we do about outdoor activities? There's been a large discussion in this country over the last, I suppose, week about young people gathering in the outdoors and having what some seem to regard as inappropriate levels of fun. My own thought is that it's better to gather outdoors than indoors. I don't know if you have thoughts on that, Chris, as to if people are going to meet up, where and under what circumstances should they do so?
I mean, I think we know that outdoor transmission is a lot safer than indoor transmission, and much, much less likely to lead to infection. So, I mean, I'm quite relaxed about outdoor meetings, to be honest. I think there are issues that people have to use crowded public transport to get there, or if you're in big events where you need to share lots of facilities like toilets or whatever. But in general, if you're meeting up with a group of friends and it's outdoors, then I think that's pretty fine. And actually, when England opened up outdoor spaces on the 29th of March, nothing, cases carried on going down quite a lot actually over Easter. So I think that was obviously when we had the Alpha variant dominant, not the Delta variant. But there hasn't been, as far as I know, any indication that's particularly spreading in outdoor spaces.
Well, we're being asked a question about the UK vaccination programme, and I think you've touched on this earlier, that Britain has concentrated on giving first dose vaccines to large numbers of people. So the number of people who have had a second dose of vaccine is relatively small still. And the question is, would you be inclined to accelerate the second dose in the UK setting where Delta is climbing, rather than pushing first dose vaccines for more people?
So they are actually doing that. So we did have a 12-week interval between doses. And I think there's no doubt that given we were rolling out at the height of our second wave, that saved many lives, actually, because one dose does protect you pretty well. I think 85% protection against severe illness and death. And that's against the Alpha variant, which was dominant then. But what they've done now is they've accelerated it to 8 weeks for over 50s. And they're doing that now. I think they're reluctant to go much lower than that because for AstraZeneca, the evidence is that the longer you wait between doses, the more effective the final protection is. So there is a trade-off between if you go too quick together, you actually lose some efficacy. You don't want to do that. For younger people, it's less of an issue because they're only just coming up to their first dose anyway. So the under 40s have only started getting their first dose in the last couple of weeks. They're all getting Pfizer, and there is, I think, an argument if we have the supply to move to a shorter dosing interval, maybe 4 to 6 weeks. But I don't know if we have the supply, so that's the question as well. Like, one thing that that our government isn't particularly transparent about is its vaccine supply. So I don't know what's in the pipeline.
It's certainly been a practical issue across much of Europe. Andrew, have you got a contribution to this?
Yes, I was just going to say, I feel very uncomfortable knowing that there's a large part of the population with no doses at the minute. And I think that worries me or concerns me more than having a few people with only one dose. And I think it's that trade-off at the minute between accelerating those second doses and delaying those first doses, that I don't think I feel comfortable with delaying those first doses, because if someone hasn't had a first dose, then they're even further away from getting that second dose. Now, they're obviously less vulnerable in general because of the way we're doing the rollout, but I would be advising as possible to get those first doses out as quickly as possible to the people who are younger and more likely to be mixing, whether that's outdoors in Ireland or indoors in the UK, and using that remaining AstraZeneca supply for the people who've had that first dose of AstraZeneca to use up that supply rather than just rushing to get second doses, because if we rush to the second doses, it has that potential to tear through the completely unvaccinated population. And I think, if possible, we should be trying to get jabs in arms. And the Wales approach of storing the jabs in arms rather than storing it for the second dose has shown signs of success so far.
Okay. Aoife, you had something you wanted to bring in.
Hi, Christina. First, it's so great that you're able to join us today. It's just such a font of knowledge, and we have been really listening to you over the last while. It's been amazing, the information, the analysis you've been bringing. It's been so valuable for us, in fact, because you have in the UK, you've got such good genomic surveillance, And this is really serving as an early warning to us. I noticed what you said about that you would really discourage travel between the two islands. And I think that is definitely sensible. And I think, we should be definitely benefiting from what you're saying. And you mentioned that you're not that concerned about outdoor, which is great. But our government has been talking about, telling us to plan for an outdoor summer and for a holiday within Ireland and all of this. And then in the last couple of weeks, the tone really changed and they started talking about international travel and they started talking about opening indoor hospitality without apparently stipulating criteria in terms of ventilation and things like that. What's the situation in the UK now with regard to that? And do you have any thoughts on the indoor hospitality situation?
The situation in England is a bit nuts. I think basically what it is that everyone kind of knows that we shouldn't have gone to the last step where we opened up indoor dining, opened up international travel, but we did it anyway. And so you've had government ministers going and often sometimes the same one on different days saying, yes, things are open, enjoy it. You can hug people, you can travel, go to Spain, go to Portugal. Oh, but actually really don't travel if you can possibly avoid it. Or really you shouldn't be having holidays this summer abroad, or still be really cautious. It's up to you to be careful. And it's just these really weird kind of messaging of saying, well, we don't really want you to do the things that we have just literally said you can do. And relying on individuals. And I think part of that, I don't know how much of that is a conscious desire to shift the blame when and if there is, a big surge, and how much of it is that they can't quite bring themselves to admit things potentially bad. And so they just kind of keep going and hope beyond hope that our vaccination program will blunt the impact. And I mean, I hope that too. Now, whether it will or not, I guess remains to be seen. So for international travel now, you can travel to what they call green list countries. The only one that's really accessible is Portugal, because the others are either really, really far away, like Easter Island type places, or don't want people from the UK because of the Delta variant anyway. And then there are lots of what they call amber list countries, which is most of Europe. And there it's that you can go, but you have to isolate at home for 14 days if you go. But there aren't really that good checks. I mean, we've only just had a new terminal at Heathrow where they put red list travellers. Until then, everyone was mixing together for hours in the halls. I mean, it's just stupid. We pretend we've got a border control system and we just don't at all. And I can see that, so France and Germany have said people from the UK have to have managed isolation if they come there. But Spain hasn't. Spain says come. Presumably French, British tourists will be going to Spain. So you're like, well, surely by now we could have worked out how to have a bit of European or global solidarity on managing this as a global pandemic that doesn't actually stop at a border. I don't really get it. I mean, on indoor hospitality, I don't think it's a good idea. And I think people hate me for saying that. But I can't quite see how it can be a good idea right now, and until evidence emerges that it's not as dangerous as we think. I mean, that's the kind of evidence I want, that it isn't as bad as we think, not that we hope it's not as bad as it could be.
Yeah, and we're having we've had all this huge reaction over the last few days to some pictures of people socializing outside in the streets, while at the same time the government is making plans for people to do something we know is much more dangerous, which is to mix indoors without ventilation. So they're getting upset about people drinking outdoors, and then people complain about the litter. It's like glitter is a problem, but it's not a COVID problem, so stop pretending that they're mixing all their things up together. But the idea that we don't have that international coordination, and on a European level, I have to say it's been very disappointing that we haven't been more coordinated. I think there's a real opportunity missed there. And we had in Ireland a very similar thing to what you're describing there. We saw it in December when there was the reopening of hospitality, and it was indoor because outdoor dining in December is not exactly cozy. And the government was saying it's open, but don't go. Why do you open hospitality except for people to go, or to bankrupt all the restaurants, right? Because if they're opening and getting their staff and their food in, and nobody goes because the government also told them not to go, it's such mixed messaging, and it's extremely confusing for people, and not everybody reads every line of news the same way that we might. I'm following the news very carefully, and I'm a news junkie at the best of times, but I think to expect that the general public is keeping up with all of these contradictory messages, and I have good friends who would be very conscientious people who would follow every rule so long as it exists. But as soon as they're told they can do something, they think that means it's safe. Like, they trust the government to only open when it's safe. And I think it's very confusing, and it's very mixed messaging. I think it's going to be quite damaging. And it'll be very interesting to see now what happens in Ireland, because we have been given weeks and weeks of warning from you and your colleagues. We've been given weeks and weeks of warning about this. And when we had originally been set up and told to expect, a domestic summer, an outdoor summer in our own country, and suddenly they're changing the parameters, and I hope we don't pay a huge price for this. And it's one of these cases where, like you say, Christina, we shouldn't be just hoping things don't turn out badly. We should be taking control of the things we can take control of.
Yeah, definitely. Like, Ireland's a beautiful country. I'd love to spend the summer in Ireland.
Especially when the sun shines.
Next summer.
Yeah, we're not having you this year, Christina. Sorry.
I'm not coming. Don't worry. I'm sticking to. I'm going to Scotland where they already have it. It's fine.
Okay.
But I do think, like, with travel, I sometimes also think that Europe and North America have a responsibility to the rest of the world. There are a lot of countries out there who managed to keep COVID out, who suppressed it through really strong public health measures and strong border controls for well over a year now, at quite a high cost for some of them, especially places like Thailand and Vietnam, to their economies, some countries less so. And now they have maybe, less than 1% of their population vaccinated, no prospect of mass vaccination for a year at least. And Vietnam, Thailand, Taiwan now seeing really big surges, and it's heartbreaking. Uruguay as well, South America is going up, massive surge. They never really came down. And it's kind of, what responsibility do we have to the countries that actually can't vaccinate their way out of it anytime soon? And actually all we're doing is helping to spread these new variants, which are now much more transmissible and much, much harder to control with public health methods. That's the problem. Like, the more transmissible something is, the harder it is to do contact tracing, to use testing, to use all of those traditional methods to keep cases down, right? The more likely it is that you're going to need more restrictions and lockdowns. Yep. That's what's so frustrating about it, is people say to me, "Oh, you love lockdowns." I'm like, I really don't. Why do you think I'm shouting about it? I want to avoid it. It's just so frustrating.
We've suffered the same criticism. Oh, you've got more questions. Go ahead.
We've got two more questions I think are interesting. One is more of a comment. In Ireland, the people waiting for the second AstraZeneca dose includes many of the most medically vulnerable and the majority of 60 to 69-year-olds. And speaking as one of the medically most vulnerable, I understand this exactly. And obviously, both of these groups are at high risk if the Delta variant becomes dominant here. So is there any specific action we can take that might serve to protect this group of particularly vulnerable people? Because the evidence is the AstraZeneca, that one dose of the AstraZeneca does not provide great protection against the new variant, against the Delta variant. Anyone got thoughts on that?
My thought is to keep it out.
Yeah. My thought as well.
But that's the most effective thing you can do. Once it's dominant, it's very hard to protect the vulnerable. Like, it's not a strategy that's worked anywhere, ever. So, you either keep cases down and potentially you try and keep out the potentially more dangerous variants, and you do what you can to accelerate vaccination. But the thing with AstraZeneca, as we talked about before, is that the longer you wait, the better it is as well. So there is that trade-off between kind of giving it enough time to get the maximum effectiveness out of it.
There's another interesting question. One of the things that absolutely shocked me about the response of some people to the COVID pandemic was the unbridled glee in some people when there were major outbreaks of COVID-19 in Australia after they had brought the virus under control the first time, and when there were outbreaks in Auckland in New Zealand after they had brought the virus under control. There were several people who were saying, look, this is proof that it can't work, which I thought was very inappropriate. But the question that's being asked is this. New Zealand and Australia in particular are now both dealing with small outbreaks. And the question is about what is their end game? Do they have a good vaccination program to get them out of lockdowns and restrictions? And China is in a very similar situation. Very few cases, but relatively small number of their population vaccinated yet. So what are your thoughts on the end game for countries that have managed to control the virus more effectively than ourselves and most Western European countries?
I mean, I think for China, it's not too hard, to be honest. I mean, they have 2 vaccines that they produce domestically that presumably they have the manufacturing capacity to ramp up. They have a very centralized system where, if they wanted to, they could go door-to-door vaccination, and I'm sure they could mobilize and do it pretty quickly. And they also don't have that much travel across borders. So I think the situation for them is a bit easier. And then when they do get outbreaks, they're in a position to crack down very quickly on them and stamp them out again. For Australia and New Zealand, it is quite interesting. I've seen the same thing with the Glee, and I think, New Zealand spent maybe 7-8 weeks in lockdown over the last year, and England spent 6 months. I mean, I know where I'd rather be, to be honest. To me, they're signs that it is working. Their systems, they can pick it up and they can act and stop it coming back. Now, Australia has highlighted that they currently got an outbreak of B.1.617.2, which is like the less transmissible brother of the Delta variant. And they're really struggling. And I think that is part of the problem, where you have a population that actually hasn't been exposed at all, that even a bit more transmissibility can cause massive issues. If they got the Delta variant, it would be really, really difficult. So I think their way out has to be getting to 80% of the population vaccinated, getting really high proportions vaccinated. Like we have seen in Israel. Israel is the only country that's really vaxxed their way down to zero COVID. And they did it by having quite a strict lockdown until quite late on, until they'd done maybe 75% of adults vaccinated. Yeah. And even then, schools went back quite late, and they still had mask mandates indoors. And it's only now they're starting to get rid of those, and they still have really strong border controls. And they have now got to the situation where it looks like new variants can't take off very easily. I mean, they have had a few outbreaks of Delta, but it's never really taken off. So I think for Australia and New Zealand, and countries like them that have the opportunity, they have to wait until they get there. Because I think opening up when they're only halfway there does risk it really ripping through the unvaccinated. Because at least in Ireland, and I don't know about Ireland, but in the UK, the unvaccinated population, about 20% of people have had COVID and have had some protection from that. Now they don't have that. So it could go quite quickly, quite bad, but hopefully they can vaccinate quickly enough. But I don't know quite what their plans are for doing it. I know that there's still a very low percentage of vaccinated out there.
Yeah, Christina, they have a supply issue. Tomás.
I know we're running out of time, but I just want to ask on that topic, where do you see the end game for the United Kingdom and for Europe, since the UK is leading Europe in the vaccination campaign? If there are no serious escape variants, which is still a risk, then we may have widespread vaccination reaching effective saturation by September, hopefully. And then we enter a new normal, the real new normal. And we will get to a stage where the effect of vaccination alone gets to its limit. And then we have a choice. We can either live with the virus with vaccination at giving us that level of protection, or we can integrate vaccination with non-pharmaceutical interventions, including travel, including reasonable travel restrictions, including disease surveillance, and local restrictions where necessary in order to keep cases low. And it seems to me obvious that the most successful outcome for society will be combining these two approaches to give people maximum freedom and maximum safety, and to open the economy as much as possible. But it feels to me also that we're not really having the conversation about what that looks like. What is the post-vaccination world going to look like in Europe? What are the choices that we have to make here? And what do you think is on the horizon for the United Kingdom in that respect?
I mean, I think I pretty much agree with what you said. I think, assuming there are no high escape variants that come, then by September, hopefully, UK and most of Europe will actually be pretty protected and have a high percentage of its population, not just its adult population, protected. And so then, the immediate term is there a really bad, what's called an exit wave, which is what I'm currently worried about. But after that, it should be self-limiting once we vaccinate enough people. But then, do you end up with quite high levels of circulating virus that are constantly popping up in pockets, and we kind of damp down and we just accept quite a high level of sickness and potentially hospitalizations? Or do we really keep trying to suppress it? And I definitely am on the latter. I want a measles strategy. We don't talk measles. We vaccinate when there are outbreaks, we accept there are outbreaks, and we stamp down on them. And that's kind of how I would like us to see COVID. Now, with measles, pretty much every high-income country has the same measles strategy. And so measles is pretty low everywhere. Now, if in Europe you have some countries that go for kind of a suppression strategy and some that go, well, we're happy to live with quite high levels, then you're constantly going to be reseeding it in the low-level countries. And that's kind of the issue, that I think this is something where you need a global response, or at least a quite big regional response. I can't see that, France has a different strategy to Germany. I can't quite see how that's going to end well. And I mean, the other thing I think we should think about is what we can take forward, and ventilation. Like, good ventilation is a good public health benefit, regardless of COVID, right? So why don't we just invest in putting really good ventilation in our indoor spaces for the next few years, for the next pandemic, for colds, for flu? Why don't we just do things like that? Why don't we consider, should we actually put things like hand sanitizer at the front of every shop every winter, to help prevent the spread of colds and flu? I don't know about you, but I've had far fewer colds this year. We nowhere in the world had a flu season. Can we do things that actually just make us all a bit healthier and say, well, why were we living with 20,000 flu deaths a year? Why? Yeah. Are there things that we could do that actually aren't that burdensome to reduce that? And I kind of feel like those conversations aren't really happening either.
I think they're a really important conversation, and I think we will be taking them further. But we have to wrap up at this point. So I really would like to thank you very, very much for your time. That's been one of the most fascinating seminars we've had. So thank you indeed. It's been very instructive. And I'm hoping we can persuade our government to reflect more carefully on what they're doing and where they might be going over the next few weeks. So thank you very much indeed. And we're going to finish up with the seminar now.